Namaste. IJV and Dr. Shaima Khatri from Faculty of Physiotherapy and Diagnostics, and today in this video we are going to talk about orthosis and prosthesis. So let's begin with it. First, orthosis. Orthosis is derived from the Greek word ortho, meaning straight, upright, or correct. That means orthosis is a device which support anatomically, functionally, and correctively. It refers to a static or dynamic device and is preferable to splint or brace, which refers only to static device. Three-point pressure principle, which is known as principle of Jordan. Here, F1 equals to F2 plus F3, where F1 is used as a corrective force and F2 and F3 is used as a counter force. So we can say that the principle of Jordan says that any of the deformity, if we need to correct the deformity with the orthosis apply one corrective force and two counter force. The three-point pressure principle forms the mechanical basis of orthotic correction. A single force is placed at the area of deformity or angulation. Two additional counter forces act in the opposing directions. Functions of the orthosis are prevent deformity, assist function of a weak limb, maintain proper alignment of joints, inhibit tone, protect against injury of a weak joint, allow for maximal function independence, facilitate movements. If orthotics have some consideration points, so it can be cost, energy efficiency, cosmosis, temporary versus payment, dynamic versus static, encourage normal movement. The orthotic interventions are ensure continued proper fit, donning doffing orthosis, implement progressive wearing schedule, patient caregiver technique, which includes skin inspection, care of orthosis, mobility training with orthosis. What so? If we apply the orthosis to anybody, what are the goals of the orthosis? The goals are as follows: maximize functional mobility skills with orthosis, maximize independence with zoning doping, maximize independence with wearing schedule, maximize independence with skin inspection, maximize competence with care of orthosis, alignment. Correct alignment permits effective functions, a minimized movement between limb and orthosis, that means positioning, minimize compression on pressure sensitive tissues. The name of the lower orthosis are shoe, shoe. The foundation for an orthosis, shoe can reduce area of concentrated pressure or pressure sensitive foot. Shoe is a traditional leather orthopedic shoe or athletic sneaker can be worn with orthosis. Attachment can be external or internal. Blucher opening has vans. Flaps contain the laces style that open wide apart from the interior margin of the shoe for ease of application. Ball opening has stitched down vans not suitable for orthotic wear. Next is foot orthosis, which is known as FO. A semi-rigid or a rigid insert worn inside a shoe that corrects foot alignment and improve function may also be used to relieve pain. Foot orthotics are custom molded and are often designed for the specific level of the functioning. So, if we talk about the different kind of orthosis, we found that there are regional orthosis of upper limb, orthosis of lower limb, and spinal orthosis as well. So, orthosis of lower limb may include your shoe foot orthosis, ankle foot orthosis AFO, knee ankle foot orthosis KAFO, hip knee ankle foot orthosis HKAFO, as well as upper limb orthosis are there different type of splints, and spinal orthosis are lumbosacral orthosis, thoracolumbar orthosis, sacral orthosis, cervical orthosis. If we talk about how the orthosis, what are the materials of orthosis are used. So here the material can be wood, can be plastic, can be anything which is lightweighted. If we talk about the material which are rubber or plastic, there are two kind of the material we found. One is your thermosetting and another is your thermoplastic. Now, if we talk about that what are the processes, so the processes are the res- artificial limb, which use over the area of residual limb. Hope you understand it well. If you have any queries related this video, ask me in comment section. I will resolve that. Namaste. खुश रहिए. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University.